and welcome to this brand new series, Wellness Watch, a special show curated to ensure a healthy you. A show that explores the health challenges and ailments that affect people irrespective of nationalities or ethnicity. But the catch here is to acquaint you with a wide array of possible treatments and medical procedures India offers for these ailments. Reliable, cost-effective treatment of international standard in India is not a distant dream now. So let's embark on this medical journey, Wellness Watch, with me each week. I'm your host, Preeti. Let's take a look at the medical headlines that grabbed eyeballs this week in our segment, Newspeg. Ghana confirms first Mpox case of 2024, but variant not yet clear. Monitors 25 contacts. US ships Marburg vaccines to Rwanda after 11 die in the outbreak. Thousands of UK newborn babies to be screened for over 200 genetic conditions, screening to help early diagnosis for genetic diseases. Outbreak of H5N1 avian influenza hits Hungary and Italy after several months. And United Nations aims to start second round of polio vaccinations in Gaza in mid-October. Today in Wellness Watch, we explore a topic that accounts for more than 12% of global disorders: mental illness and mental well-being, something that people have faced in some point or the other of their lives, knowingly or unknowingly. Also, October 10th is observed as the World Mental Health Day. The theme this year is, it is time to prioritize mental health in the workplace, and it underscores the growing need for mental health support in professional environment. Mental illnesses are defined as conditions that affect a person's thinking, feeling, mood or behavior in a way that impairs their ability to relate to others and also function each day. 1 in every 8 people globally suffers from a mental health issue in some form or the other. Anxiety disorders, ADHD, behavioral and mood disorders, eating disorders, schizophrenia, bipolar disorder, post-traumatic stress disorder. Now, these are some of the mental concerns, to name a few. However, poor mental health and mental illness are not the same thing. A person can experience poor mental health and not be diagnosed with a mental illness. Today in the show, we try to find answers to some very prominent questions. What is mental health? At what rate are mental concerns spreading? What is the level of awareness in people on mental health? What are the types of mental disorders? What preventive and self-care strategies are available? And what treatment options are available in India? As concerns around mental health grow, it is clear that emotional well-being is more than just a personal matter. It impacts families, communities, and also the entire societies. Yet, despite increased awareness, many still shy away from seeking help due to the fear of judgment or social stigma. October 10th is observed as the World Mental Health Day to encourage global mental health education, awareness, and advocacy against this social stigma. The theme this year is, it's time to prioritize mental health in workplace. And in the report ahead, we explore how mental health is integral to an individual's overall health. Managing emotions is more than just a personal skill. It is a crucial factor for affecting millions of lives worldwide. Every day, people silently battle mental health issues, and the ripple effects touch not only them but also their families, friends, and communities. Despite the growing awareness, a staggering number of those suffering from mental illness still shy away from treatment. October 10th is observed as the World Mental Health Day. The theme this year is, it is time to prioritize mental health in the workplace, and it underscores the growing need for mental health support in professional environment. According to the World Health Organization, many avoid seeking help due to fear of judgment and lack of social acceptance. They may hesitate for the fear that seeking help is a sign of weakness. However, the consequences of this hesitation can be devastating. If left untreated, the mental health issues can quickly spiral into serious concerns. What many don't realize is that mental illness can affect a person in countless ways. The symptoms are diverse and the experience is deeply personal. Anxiety disorders, ADHD, eating disorders, schizophrenia spectrum, post traumatic stress disorder are some of the concerns, to name a few. While some may experience persistent feelings of sadness or anxiety, others may struggle with mood swings, lack of focus. It can affect anyone, regardless of background, age, or status. Mental illness does not discriminate, but mental health issues are treatable. With the right intervention, care, and support, individuals struggling with mental health can and do recover. Staying mentally and emotionally healthy is the key to not just surviving, but also thriving. The path to healing starts with a conversation. If you or someone you know is struggling, don't hesitate to talk about it. Seek support, share your feelings, and when necessary, consult a medical health professional. Mental health matters. Seeking help is a sign of strength, not weakness. Remember, early treatment can lead to complete recovery, but ignoring it can only make things worse. Let's break the stigma together because everyone deserves a chance to live a mentally and emotionally healthy life. Harshita Oberoi, Wellness Watch, DD India. India has gained a stellar reputation over the past decade for providing high-quality medical services at affordable cost, attracting patients from around the globe. India offers a wide scope of medical intervention for mental health concerns too. Up on your screens, we will mention the institutes. National Institute of Mental Health and Neurosciences, Bangalore. Central Institute of Psychiatry, Ranchi, Jharkhand. Lokpriya Gopinath Bordoloi Institute of Mental Health, Tezpur, Assam. All right, to talk more about mental health issues, we are joined in by guests in the show today. We are joined in by Dr. Rajesh Sagar, Professor, Department of Psychiatry, AIIMS, Delhi. And virtually, Dr. Pratima Murthy, Director, NIMHANS, Bangalore, is joining us. I welcome both of you this afternoon. Thank you so much for joining us on Wellness Watch. Dr. Sagar, to begin with you first, I would want you to help us understand what constitutes mental well-being.
Fine. First of all, my congratulations to Doordarshan to start a program, such an important program.
Thank you, sir.
And on starting with mental health, I think, and we thank you for that. Now, it's very important, as it was there in the report, that mental health is such an important component. And when we understand what mental health is, and before that, the definition of health include the state of a complete state of physical, mental, and social well-being. So, mental well-being is important component of health, overall health also. Now, when we talk of mental health, now I think there are 4 components to it. The definition which is given by WHO, one who knows his or her own potential, that is number 1. Number 2, who deals with the stress of day-to-day life, number 2. Number 3, which is important in the context of this theme also, World Mental Health Day, that is who can work productively and fruitfully. And number 4 is one who can contribute to the society and the nation. So these are 4 components which are there, which comprise the definition of mental health or mental well-being, because well-being, when we say, what it means is that how happy you are, how enjoyable you are having your life, how you are interacting with others, your interpersonal relationship, the joy which is there. So that's the overall well-being which is important. So health and well-being, health is the illness part of it, whereas well-being is something where we say that overall, where where how happy you are, how you can connect with people, and so on. And in a way, when we talk of mental illness, go ahead, like the health, mental health, and mental illness. Now, again, it's a illness of behavior, thinking, emotions, and so on. But there are 2 things which are important. One, because most of us go through anxiety symptoms. Sometimes if something bad happens to us, we feel sad also, but that does not mean that we have the illness. So to have the illness, there are 2 things which are important. One, which causes a distress to a person. Distress is very, very important thing. And number 2, you have the dysfunction for it. Now, dysfunction means that because of the sadness, you are not going to office, you are not going to college, or you are not meeting people. So, these are this. So, distress and dysfunction are important component to call as a mental illness. Now, again, it is important that what the survey, the data, when we see the kind of epidemiology, it talks about the disorder per se. That's one tip of the iceberg.
Yes.
There are many people who doesn't fall in the disorder, but they also have some kind of distress which is there, which does not amount to disorder, and which again have issues related to interpersonal or functioning. So they are the one who are important group of people. Then again, when we talk of mental illness, we need to understand that they are different from other physical illness also. Now I will tell you how. One, in mental illnesses, there are people sometimes may not have an insight to the illness. Now what I mean by this is that like suppose I have a chest pain or abdomen pain, stomach pain, I know that I have this problem. But when the mental illness is, there are some form of mental illness where one is not aware of it, that they have the illness, where the family members take them to hospital. So they are not aware of it, number one. Number two, mental illness are the one, the major obstacle for the treatment is stigma and discrimination. They are stigmatized, and because of stigma, they do not seek a treatment. That is why we have a huge treatment gap, up to the tune of 80 to 90% the treatment gap is. When I say 80 to 90% means out of 100 people who are there, only 10 to 20% of people they go for the treatment. So it's a huge treatment gap. Number three, which is important, that for no other illness we have the act. So for mental health, we have a Mental Health Care Act. Our government, our country has that. So because to protect the rights of the person. So in these ways, they are different from physical health or physical illnesses. That is why we need to pay attention to it. And also it is important that those who have a physical illness also can have a mental health issues also. It's not dichotomy complete, because mind and body looks different, but they are closely related. Like anyone who has a physical illness can also have a mental health problem. Those who have mental health problem can also have a physical symptom like sleep problem, appetite problem, fatigue, and so on. So I think that is why in a context when we understand what mental health is, this is what the overall concept of mental health is.
Mental well-being. All right, I'll take that forward to Dr. Murthy. Dr. Murthy, Dr. Sagar, tells us that distress and dysfunction are very important aspects. Now, stress, mood swings are something that we all live with every day. But when is it that a person should know that he is suffering from mental illness?
Okay, so I think the first thing to understand is that these lie on some kind of a continuum, and psychological stress, like Dr. Sagar mentioned, is something that we all face in day-to-day life.
Yes.
One of the components of mental health or well-being is the ability also to handle normal stresses. So there are thoughts that we all have, there are feelings that we all have, there are behavioral issues and interpersonal issues. So when any of these get disturbed, either our thoughts get disturbed, our feelings are upset, we have difficulties in our interpersonal relationships, or we have emotions like anger that we cannot control, there can be a lot of psychological distress. But to take the point further, why it's like a headache, for example. I mean, a headache may be due to a variety of causes. Similarly, psychological disturbances can be due to causes within ourselves or from the environment, and very often it's a combination of the whole thing. So for example, certain people with certain temperaments which make them very anxious, which make them feel very, very easily unable to deal with normal stresses, can experience a lot of psychological distress. Others who have difficulty in maybe paying attention, concentration, particularly young children, can have problems. Others can have substance use, the use of alcohol, tobacco, other psychoactive substances, and very often they're used to deal with anxiety, to improve the mood, and so on. So all of these, and of course stresses in the external environment, it might be disappointments, it might be examinations, it might be workplace stress, as is the theme of this this year. So any of these can cause anxiety, depression, sleep disturbances in our daily schedule. But when these become severe enough, what happens? Let's take the example of a low mood by itself. A low mood by itself in response to an external stress can be overcome by self-care, looking after oneself. But if that low mood is also accompanied by significant sleep disturbances, negative thoughts, particularly a feeling of helplessness, hopelessness, not wanting to live, and even a wish to die or even a wish to end one's life by suicide. Now, these kind of symptoms of feeling helpless, hopeless, not at all sleeping, if they last for more than a few days, then I think it's very important to take professional help. The second thing is, for example, when anxiety, a normal feeling of anxiety before an examination sometimes is useful to make one do better, whether it's in an examination, in an interview, or any other kind of situation. But when it becomes overwhelming to such an extent that the person is not able to function, is not able to speak, is not able to write in an examination, then of course, again, it necessitates professional help. The third thing is the loss of judgment and reality contact. So, for example, in a disease like schizophrenia, a disorder like schizophrenia, the person starts having thoughts that other people are harming them. They start experiencing perceptions, hearing voices of other people, feeling that they are being controlled by an external agency, and then there is a loss of judgment. So when there is such a loss of judgment, the person's reality contact is impaired. And that's a sign that the person needs help. The person themselves may only have these subjective experiences, but when it translates into, for example, aggression, violence, extreme degree of fearfulness and paranoia, that also requires treatment. So it's the severity of the symptoms, the distress the symptoms causes, and the loss of touch with reality are some of the areas where professional help would be indicated.
All right, so that is where professional help is needed. But Dr. Sagar, I would want you to very quickly explain to us what are the disorders, because people today still find it as a social stigma to go and seek professional help. Help us understand what are the disorders that are associated with mental well-being.
That's a good question. Basically, one, what we have to understand is that there are symptoms.
Yes.
Like, say, for example, you have a sleep problem, some anxiety, which does not amount to a disorder level. Now, when we talk of disorder, there are two major types. One, what we call as a common mental disorders, and the other is what we call as a severe mental disorders. Now, severe mental disorders are the one which Professor Pratima Murthy talked about, one who lose a touch of the surroundings, or they have delusions, they are, some kind of thoughts are there, like someone may harm, or they may have hallucinations. So that's a severe mental disorders, or there can be bipolar disorder, which again, one is excited or overactive and so on. So, but the common ones are the one anxiety disorders, like depression is, which again is very easy to identify, or even substance use, alcohol disorders, use disorder and so on. Now, to tell you about depression, one who has the symptoms of low mood for more than 2 weeks, along with low mood, there may be fatigability or low in energy or loss of interest in any activity, along with other symptoms. So, by which we can diagnose. One good thing about mental health disorder is it's very easy to diagnose, and also there is a complete treatment available to it, because so when we talk of these disorders, like even anxiety disorder, which is there, like there may be bodily symptoms, palpitations, sweating, feeling on the edge, and so these are some of the common symptoms which are there. But also we need to understand that some may be situation specific also. Maybe you have to go for an interview, so you did not have a good sleep, so again you got anxious, so again there's a vicious cycle to it, and so on. So but what is important is that one, it is easy to identify, and two, the treatment is available.
The treatment is available. That brings me to the next question. So what medical advancements have been made in India, particularly regarding to mental health?
Yeah, I think we should know that in India we have all kinds of medicines available which are there in Western countries. In fact, we are fortunate to have medicines which are there in a country like North America, that is USA, and even from the Europe. So we have the mixer both medicines are available. Along with medicines, we have a whole lot of different kinds of therapies which are there, and many like cognitive behavior therapy and different kinds of therapy, because here it is important to tell that our treatment is not only dependent on the medication only, because for other medical disorders predominantly medication, but here it's a combination of both medicines plus your therapies and counseling and taking session with the family and so on. So a whole lot of treatment is available. Now also we have something known as neuromodulation which has come up, where we have something like RTMS, TDCS. So these are something neuromodulation techniques which are there, like what is there in Western country also are available in our country, along with the whole where we take session with the family in the therapy, and so all kinds of therapy which are there in Western country are available in our country as well.
All right, I'll take that forward to Dr. Murthy as well. Dr. Murthy, update us on what all medical advancements have been made in India with regard to mental health. You're there heading NIMHANS. Get us more as to, how do we showcase India as a medical hub in terms of medical well-being for the rest of the world?
So I think one of the things is what Dr. Sagar mentioned, that all treatments are available. The second and most important thing to remember is, particularly in South Asian cultures, culture also plays a very important part in mental illness. So for example, when one needs therapy, understanding the person's background, understanding where they come from, understanding their interpersonal needs, and understanding the way their mind works is very critical to interventions. And that's where, being in India, or, India can offer a lot of these kind of interventions to everybody. We started the program by talking about well-being. And we know that, the ideology, especially during COVID, a lot of people, for example, turned to the Bhagavad Gita as a source of inspiration to overcome several, issues like anxiety, low mood, and so on. So right from these kind of traditional sources of how to improve your well-being to yoga, there are a lot of other techniques where we kind of combine modern technology with ancient learning to be able to give interventions. Any medications are now available for anxiety, for depression, for psychotic disorders, for substance use disorders. But I think it's very important, as Dr. Sagar mentioned, to have psychological interventions. And psychological interventions allow people to be listened to in a very non-judgmental fashion, to be able to develop a trust and rapport, and to be able to change some of these thoughts, feelings, and emotions that people feel. So all of these are very important, and all of them are available.
All right, all of them are available here in India. Very quickly, we will have a quick rapid fire session for our viewers to, get the idea of mental health registered well with themselves. Dr. Sagar and Dr. Murthy, I'll ask you quick rapid fire questions. Dr. Sagar, one small step to prioritize your mental well-being.
If the society understand that they need help, so if we can remove a stigma and discrimination, I think that would be the very, very important step, that people will come forward for the treatment. And even workplace related issues, the theme which is there, I think that's one small step that can make a hell lot of a difference.
All right, Dr. Murthy, share a personal mantra or affirmation that helps you stay positive during the challenging times.
Eat well, sleep well, try and be calm, enjoy every day, learn to solve problems, and be grateful for what we have. Seek help when you can't manage yourself.
Okay, seek help when you can't manage it all by yourself. Dr. Sagar, does mental illness have a hereditary basis?
To some extent, yes, but they are not complete. Like there are certain disorders which are hereditary complete, but here maybe the risk is 10 times more or some bit more if anyone in the family has problem. So there are certain conditions where always we take a family history. So yes, but it's not complete hereditary. Okay. It is a marginal risk is increased if anyone in family has a problem.
All right, Dr. Murthy, is having a routine important for someone with mental illness?
It's important for everybody, for all of us who don't have a mental disorder, but it's also important for persons who have a mental disorder. And that routine includes staying active, being able to distract oneself, developing hobbies and retaining them, developing practices that are good workplace habits, for example, And of course, as I mentioned, good sleep and dietary habits, avoiding any kind of substance which can alter one's mood and anxiety.
All right, Dr. Sagar, how do we know if the treatment is having an effect?
Yes, but the symptoms which are there, say for example, the sleep problem which is there will be taken care of, or even
subside,
the
yes.
mood will be better, or the symptom like anxiety which were there earlier, they are getting better. But it's important to understand it may take some time to show effect. It is not like other medical condition where the effect is immediate. So one should not worry if the treatment is started. You should be patient, but be in touch with the doctor. And your symptom which are there for you have gone to a doctor, they will go gradually and your functioning will improve. Like say you are not going to office or not going to college, then you start going to that and your functioning will also improve. So
all right, there is paucity of time. I'll put a closing question to both of you. As part of the society, what can we do for a person with mental illness? Very quickly, Dr. Sagar.
I think we need to understand, we need to give a support to everyone who has a mental illness, and we need to see that they also are part of our society, and we see many instances that they are embarrassed at times, they are bullied at times,
Yes.
we pass comment on them. So the message to society is that how we can lay our hand to them and be supportive to them, and because they are one of us, I think, and that is why they will get much better, and that's an important message I want to give to the society.
Dr. Murthy, your take on how as a society we can help a person with mental illness?
I think we just need to understand that health means both physical as well as mental well-being, and they simply cannot be dissociated from each other. We need to understand mental disorders just like physical disorders, that there are causes, maybe familial causes, maybe causes in the environment, maybe stress brought on by various other things. So interventions also include both counseling as well as various kinds of pharmacotherapies or other physical forms. Most important thing is that mental disorders are quite common. They need to be recognized. People have a right to treatment. People must know where to get treatment. And with treatment, people can get back and lead very productive, happy lives.
All right, on that note, we'll end this discussion here. Thank you so much, Dr. Sagar and Dr. Murthy, for joining us on Wellness Watch this afternoon. And Glenn Close had said, what mental health needs is more sunlight, more candor, and more unashamed conversation. Taking care of your mental health is an act of self-love. A healthy mind will help you cope with stresses of life, be physically healthy, have good relationships, and realize your full potential. Remember, there is no health without mental health. And with this thought, we end this edition of Wellness Watch. Till we meet next, take good care of yourselves. Bye-bye.